Charlton, how long have you lived in Fitzroy or been connected with Fitzroy?
55 years, from March 1946 to the present time.
hmm And you had some periods when you didn't live in Fitzroy?
The home was always here. My
Yeah.
wife and children would be here, but there would be times when I might be away for some months, and then if I happened to be away for doing work in other states or in the
Yeah.
Northern Military, my wife would be with me for even sometimes several years, and kiddies as they grew older would live elsewhere.
Yeah. And what are some of the major changes that you have seen in Fitzroy in your own experience?
Well, in my experience, of course, was as a doctor in what we call in those days general practice, and nowadays perhaps more precisely family general practice. But in addition, I did other work in the sense which is not usual in city general practice, in that I was doing some surgical work, private hospital, but I was also for a time part of that. The first 15 years of my time at Fitzroy, when I was in general practice here, was I was associated with Royal Health Hospital clinical system,
Yeah.
and I would do in private hospital practice,
Yeah.
surgical work associated gynecology and obstetrics.
Yeah. So you've seen lots of changes in the clients and that you saw in your practice,
Lot of changes.
in the ethnicity of
Oh yes, when I came here in March 46, it was shortly after the end of the World War II.
Yeah.
And I had the experience of meeting a lot of so-called New Australians here as patients. They were very
Yeah.
largely Macedonian, Italian. They were the predominant groups of New Australians, but there were still plenty of old Australians here
yeah.
at that time. That ethnic mix was built, my practice was built around those. My practice extended from, centred in Fitzroy, but it
Yeah.
also extended into the city
Yeah.
and into Collingwood and Northcote.
hmm
There were a few outlying places on their occasion, few, but it was essentially in Fitzroy and
Yeah.
East Melbourne,
hmm
and and most of the people, New Australians, were centred in Fitzroy and Collingwood. And I saw quite a lot of those people, and many of my patients, I had very happy professional relations with them.
Yeah.
I look back on it as a somewhat rich experience, which I never regret having experienced.
Mm.
Over these years, the 15 years of I was in practice here, things were pretty much the same, but towards the end of that time, some of the ethnic groups would be moving away to other suburbs.
hmm
I understood a fair number of Macedonian people tended to go up to Thomastown, places like that, so that it became less of a mix and more old Australian. Over that period too, I noticed perhaps I could put it this way, I feel that I need to concentrate on those first 15 years because that's the time when I was closely associated with Fitzroy.
hmm
Although as a professional person, afterwards I trained after those first 15 years, teaching hospitals, Melbourne, in pathology, specialising in particular branch of pathology.
hmm
And I lost contact. I withdrew from general practice, and I spent those next 6 to 10 years training and working first in the Commonwealth government, but not here in Melbourne. I went to other parts, to Bendigo, and then time in Darwin, a short period there, and subsequently to Townsville in North Queensland. And I have never returned to general practice after those first 15 years, and so for the last 40 years I've not had any contact with Fitzroy general practice. I've been dealing with pathology in those government services, and ultimately in the last few years I've been doing research work in a particular field of anatomical pathology here in Melbourne in one of the teaching hospitals. And that's that. So that although I've not been intensely associated with that story, I've always come back and lived here time to time. Yet it's hard to imagine how I did it, because my wife and I would be, as the kiddies got older, I'd be living in Wagga Wagga in New South Wales over a period of 7 years. But I'd always be coming back here. I have noticed, comparing what prevailed in my active time here in general practice with what now prevails in Fitzroy in recent years, that in my opinion there's a very distinct improvement in the standard of public health service, in the housing by and large is much better standard. Street cleanliness is much improved. Garbage facilities, garbage collection facilities, very markedly improved. So that there have been many a good thing in that regard. On the other hand, there have been very marked social changes in that I notice, or it's my impression I should say, since I'm not involved in general practice, my impression that families are so firmly established. When I would go to houses, the mother would be there, the children would be there, the husband would be away working. As it is now, with the influx of women into the workforce, that sort of situation has changed. In those early days, I would deal with people like the Melbourne District Nursing Society. On very rare occasions associated with them, I would confine, say, a woman in her home because she didn't want to go to the hospital. Rare occasions I would give blood transfusions to ethnic people who had some reluctance to go to a public hospital for some reason. Some parents from those same groups who would, not commonly, but sometimes want their child to go, and I would treat them at home. Sometimes even I would advise against it. So it was an interesting experience to see how different people responded to the situation.
So do you think that's service or intimacy?
Well, I think
do you think that the intimacy and the service in the medical profession has changed?
Well, I think
the closeness that you had.
Well, I think so, because I think that looking back over a relatively long medical career, the first 15 or so years here, that was general practice, but subsequently it's been in pathology work. I think that while there have been many great improvements, the explosion of medical knowledge which has occurred in recent years, 20 years, 30 years, 40 years, goes on at ever increasing pace. Explosion, dispersal of information, with information technology, these things have taken off. The pace of life has stepped up enormously compared with what it was. The question comes up is, all these things have much to recommend them, but they tend, in my opinion, to alter the doctor-patient relationship to a degree. I mean, the doctor has to do his best to keep up to date as much as he can, and it's quite impossible to do it all. If it was a general practice, it's impossible. Even people who specialise in a particular field, they have to make it a super specialty to get by. Well, but at the same time, all this is achieved, in my opinion, at the expense of the doctor-patient relationship as I knew it. Perhaps that is a thing which can never be restored, and that is a difficulty for doctors, difficulty for patients, difficulty for government, difficulty for hospitals, difficulty for nurses. And I'm sure everyone involved in these things does their level best to try to cope with it. But still, I think that human beings, as they are, they do best if they can have a doctor, their doctor, that they trust. As it is now, people are tending to shop around this sort of thing. I think in days gone by, the influence of doctors who were conscientious, and a great many of such people, they played a very distinct role for their patient and for society. It's my impression that while there are still quite a number of such doctors, there's a tendency, I think, for that role to be fading away and to be replaced by clinics where people do not exactly have the same relationship. I think people really do. I think people are, on balance, less well off medically than they used to be, despite all the very great and sincere efforts that are made. And I think it simply means that further efforts and much thought should be put into re-establishing some of those values. You know, I mean, someone once said to me once, Dr. Charlton, don't you realise that the people want to see you at 9 o'clock at night and thereafter are probably not worth seeing? Well, that is quite untrue. I mean, a poor old lady whose husband, an elderly man, will have a stroke or something in a little house somewhere down in Fitzroy or Collingwood. I mean, she needs someone who's got an acute appendicitis or who's worried about it. I always remember a very curious, funny situation was that someone living not very far from here came to the house one morning and said, could the doctor please come to such and such an address, which was quite nearby. And my wife said, well, what was it? I said, oh, well, please come at once. So I went there. What really was the situation was that there was one of the girls in the family had announced that she was pregnant and she was not married. And this had caused great consternation in the family, as well as mine, in those days. And then the next day, the girl's mother came over and said, my husband asked me to come and thank Dr. Charlton for coming. She said, because when this bombshell burst, we didn't know what to do. My husband said, get someone, get anyone, get any doctor, get Dr. Charlton, any port in the storm. Those little humorous episodes which occur to make life a bit easier for them. But anyhow, that was just that. I don't know that there's very much more to say because I feel that I'm glad that I've had that experience in Fitzroy. And I just sum it up by saying that I think despite many efforts of many groups delivering medical care to people, despite all the things which I acknowledge as great improvement, I'm still left with a feeling that a vital thing is not as good as it could be. People need their own doctor. There needs to be a very competent general practitioner who is respected by specialists who work in conjunction with the welfare of their patients.
Okay, thank you, Dr. Charlton.
Is it reasonable?